Talk spine related stuff. So, first things first, when we talk about, and I'll show you a couple representations.
Mm-hmm.
This is the front, this is the back. And so, in the front or in the side, and even in the back, you can kind of see what the discs look like. As we age and as we go through life, these discs on the spine that I'm going to show you in this representation tend to degenerate. And the true definition of sciatica, true definition, means that we've compressed enough of the spine that we kind of herniate it out, or we compress it like almost like a stepping on the jelly donut, so much so that it pushes out, puts pressure on the nerve, and now the electrical impulse goes down to our leg. That has some ramifications if it lasts too long. I tested you for that stuff. By the way, you came up completely clean. Completely. So just because you had it in the past doesn't mean it won't affect you. But also, I will let you know that 50%, I think actually the statistic is 48% of disc herniations will reabsorb spontaneously 100%. So you're like, whoa, that's like 50%. Well, what about the other 50% of people? Like, are they going to reabsorb? The truth is, no, they're not going to reabsorb 100%, but they seem to reabsorb about another 30 or 40%, which means 90% of those people are going to, or 95% of those people are going to have long-term benefits and long-term resolution of this issue. When I say long-term, that means like you're not going to have constant sciatica every day for the rest of your life. If that's the case, it's probably because you've done enough nerve damage, you've done other issues. And to be honest, I don't necessarily need to talk to you about this because it's not your issue. So congratulations. So I just want to give you a little background. So
Okay.
Education
is good.
I did kind of, when I stretch your legs, first of all, you maintained a good enough flexibility. What I'm also doing is testing the nerves. If you notice, I pulled your leg up this way, went that way. I kind of went up into the side a little bit. What I'm trying to do is pull down on the electrical wires, going down this way, down that way, down to this way. That's why I messed around with your foot and ankle on both sides. I found that none of them going down that way cause any irritation. Typically in true sciatica or nerve irritation, you will feel that because it will roll the pelvis like this, and it'll start stretching the nerves too much, and then that'll cause some issues. So congratulations, you didn't have that. The primary cause of most low back pain is immobility within the hips. You've actually maintained a good amount of it, and you still have a good amount of it. I think you are right. You do have a little bit of arthritic changes into the knee a little bit on both sides, I felt. Probably a little bit more on the inside there, which is why I don't know if I would necessarily recommend you squat heavy weights, but like, I don't know if you do any activity like squatting and stuff like that. I'm sure your job is pretty...
I can get into it. I do get into it, and here's the problem. Sometimes I'll go out there and I'll get on a weight program or something like that, but I'll push myself too hard, and then all of a sudden my joints will hurt so bad that I can't go back. And then there's that time of not going back because you got to get over, the pain. Because like bench presses, I'll push myself and then my shoulder's right here.
I think you can do other things that are more beneficial, and that's what I'll help you kind of guide you with. And I'm not saying that they're the best because we don't know until we do them.
Right.
But like in your case, like lunges might be a better option. Half deadlifts, wall squats. They're not essentially the best exercises for every single person, but in this case, we're kind of not going like this all the way down to the range of motion and now pissing off the knees, and now the knees start to compensate. Now you start using your back too much, and now you have a back issue, and you're like, oh, my back hurts, and I'm like, no, it was actually from the arthritic part of the knees, and if you could just avoid that from the beginning, you'd be fine.
That sounds so much like me, because, I'll go fine with nothing for a while, right? And then it just seems like it'll start with this knee, and then this knee, and then it worked my way up, and then and then
I had a feeling
all
like
of my aches and pains have made their showing again, and then they go away.
That's what I'll talk to you about supplementation, because I'm not saying that supplementation is the best. I'm just saying that there's some clinical information that says this actually works for these types of conditions.
Yeah.
Because you're not having nerve pain, you're not having you're having joint pain. You're having, I think, arthritic-based pain from all your work and stuff like that.
I believe so.
But you're not having true, like nerve-based
nerve
pain.
damage or anything. Yeah, there's none of that going on.
You can definitely feel that in the neck. You're getting some pinching on the right side. These pillars up here, we call them the facet joints in this area, like here, here, and here. Those were the areas that I was kind of poking on, like these 3-4 areas. That's what this looks like here. So that's why kind of like going into this position is the corkscrewing of that position. Again, if we were to corkscrew that all the way down, the nerve should get pinched off. They were not getting pinched. Now, does that mean they're never going to get pinched? No, it doesn't mean that, but it just means that we're not pinching the nerve where the hole comes out of, like right, it's easier to see on this one. So right here. So it's just like when I kind of do that, you feel a little immobility here, but you're not getting that. The truth is, in terms of disc degenerative changes, now you're not having this stuff, which is cool, because like usually ages 25 to like 55, you normally think, and I'm just generally speaking, gunshotting it, we'd say, hey, I think this person's probably going to deal with more nerve-based like disc issues. Usually after the age of 55, the elements have adapted, your body has adapted, and it actually like becomes stronger again to some extent, where it actually adds more insult to the bone and you see more degenerative changes. I think you're feeling more arthritic type pains. So I think just keeping you loose with these muscle work, with some adjustment stuff, proper exercises, like, not working too hard. I don't think straight bar is going to be the best thing for you. I think we could do dumbbell presses. I think you do kettlebell stuff. I do think if you do straight bar, then we stay up under a certain weight. You know what I mean? Like, let's just say it's 135 or 100. You're like, hey, I'm not going to go over 100 because it starts to really damage my clavicles. I start straining my neck a little bit, then my shoulders hurt, and it just starts pissing everything off. And once it starts pissing off, then everything else starts to compensate.
Yeah.
So I don't think you're having anything that's like alarm. I think you're just having a lot of like, hey, I've been beat up for a little bit and it's time to get back in it.
Shit a lot, man.